Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today our topic of discussion is about pathological myopia and its related complication, that is macular retinoschisis. Pathological myopia basically is defined when the refractive error goes to -6 diopters or more. Axial length is the length of the eyeball is more than 26.5 millimeter. So at this stage, the eyeball has undergone so much stress because of elongation, change in the structure. It is a long eyeball now. It is no more that sphere shaped. So what is happening? The different layers of the eyeball are under stress. We can see there the retinal pigment epithelium attenuation. We can see lacquer cracks, Fuchs spots, and new blood vessels development over there, atrophic changes as shown in this photograph here. All this why happening? Because the layers of the eyeball are under so much stress that they have undergone this transformation. But one more complication which can happen in such situations is macular retinoschisis. Macular retinoschisis is basically defined as the splitting of the layers of the macula of the retina in the macular area. It may involve the fovea, the central area, or it may be extrafoveal. Yes. Another photograph showing us here the atrophic changes of the macula, pathological myopia. This all is happening because of the structural anatomical changes happening over there in the eyeball, geographic atrophy, and these things ultimately contribute to the poor vision. The OCT macula, here we can see the macular retinoschisis associated with retinal detachment. Actually, there are two forces which are acting on it. One is from the scleral side. Eyeball is getting elongated, lengthening is happening. So sclera is also exerting force. Inside the eyeball, the vitreous, which is a jelly-like structure, now has become liquefied, just like water. And now this liquefied over there, along with over there, the forces acting inside from the vitreous side, they also contribute. So these two forces which are basically involved in the manifestation of macular retinoschisis. Macular retinoschisis, as shown in this photograph, has led to the localized retinal detachment. So this is advanced stage. And this stage can be followed by the development of the macular hole. Macular hole develops usually after the development of retinal detachment in macular retinoschisis. So now the vision of the patient is at stake, and this is a complication of pathological myopia. We know different complications of the myopia like lacquer cracks, Fuchs spots, atrophic changes, geographic atrophy, choroidal new blood vessels growth over there. But when we talk about this complication over there, as I mentioned, two forces are acting over there. So how these things can be managed? If we have to manage and deal with these forces, we have to control the two forces which are basically acting on it. So this is the ultrasound B scan of the patient. Here you can see the lengthening and a dome shape, we can say the excavation like thing happening over there in the posterior pole. And this patient, as I mentioned, has developed retinoschisis plus localized retinal detachment, which is advanced stage, no macular hole yet. So how this patient can be managed in this stage? The first thing is to observe and look at the visual potential of the patient. If the visual potential is good, the patient can be observed. The second thing is that many attempts have been done to counter the two forces in two different ways. Managing the external, the scleral force is done usually by the scleral buckle. But it is very challenging even for the most experienced surgeons to explore the muscles, go up to the macula, and then put the buckle over there to the extremely thin area, which is already very thin because of elongation, just to counter that force which is from the scleral side. So, but this is not very routinely done. This is very challenging. The second thing is to manage the forces acting from the inside of the eyeball. As we mentioned, that vitreous liquefaction has happened over there, and the internal approach is pars plana vitrectomy with internal limiting membrane peeling off, with internal limiting membrane flaps, and then tamponades can also be done over there. But the success rate of these internal approach is also not very promising, because it has been done and then there is a recurrence of retinal detachment and all these things, complications happening. So basically this macular retinoschisis, a complication of the extreme lengthening of the eyeball. The eyeball has lengthened to that stage that from outside sclera and from the inside vitreous, these two forces are basically acting on the extremely thin area of the fovea. And once the retinal detachment, as mentioned in this stage, happens, then there are chances of developing macular holes also. So this is one of the complications possible, very challenging to manage, which I wanted to share with my respected audience. I hope my today's presentation, a brief one, will be beneficial in their clinical management. Thank you.